Good.
All right. So my name is Madeline Garr. I'm the co-president of the League of Women Voters Nashville, along with Laura Webb. And I just want to welcome each of you to this meeting. We're excited to hear from the speakers today. I want to remind everyone that we're in the middle of a membership drive. And this is a renew or become, if you're not a member of the League of Women Voters Nashville, which gives you membership in the League of Women Voters Tennessee and membership in the League of Women Voters US. So you get 3 for the price of 1. And we are really excited about, continuing to enlarge our membership. And men and women can become members, and people under the age of 35, we have a special membership cost for them. So if you could keep in mind that all you have to do is go to the League of Women Voters Nashville.org/member, and you can do it there. You can renew or you can become a new member. And we would really love to have you part of our organization. I also want to do a quick update on registration. I mean, not registration, redistricting. Can't read this morning. As you know, this is a very important time. Tennessee has gotten its census data, and now we are in the process of dealing with the redistricting issues. These issues pertain to Tennessee as well as to the local communities, and in our case, Davidson County. If you want information about what's going on with Tennessee, which is going to affect congressional and General Assembly and the Senate, etc., you should go to lwvtn.org, where you can get updates on an ongoing basis about where we are. And if you're interested in, I hope you are, about how it affects Davidson County, we sometimes forget that it also affects our own communities. The Metro Planning Commission is the entity that will be doing the redistricting maps. These maps will affect council districts, school boards, and school district zones. So that's very important. And they have a website called redistrict.nashville.gov. And if you go at that website, you're going to find a lot more information. But one piece is a timeline. And in September, October, there will be public town hall meetings on the draft maps that have been created. And this is when they're asking for public input. So I would strongly suggest that you would please get involved on that level. Also, I want to thank you for being here and turn this quickly over to Debbie Gold, who has an announcement. Debbie?
So just to sort of piggyback on what Madeline's already said about redistricting, we are obviously really at the beginning stages of the redistricting plan that will affect us all for the next 10 years. And I just wanted to highlight that the State League has had a series of webinars on various aspects of redistricting, and our next one is September 21st, and it will be with Jesse Mayshark, who is a veteran reporter who has worked for the New York Times, among other publications. And he will be talking about transparency and public engagement around redistricting process, and about issues dealing with misinformation and disinformation, which obviously, if you're a news reporter, you deal with a lot. So anyway, there will be further information about how to sign up for it that you'll get by email, but just wanted to highlight that that's coming up on the 21st of this month. Thank you, Madeline, for giving me the opportunity to talk.
Okay, so I will put those in the chat box, the links for both the membership and the redistricting information. And now, Carol, it's yours.
Thank you. I am delighted to welcome Renee Pratt and some of her colleagues from social services. But before I tell you much about her, I want to tell you why she's here. There are 41,000 Nashville residents that lack a high school diploma. There are far too many people working jobs that pay less than a living wage as a result of that. Nearly 39,000 Nashvillians get less than $12 an hour. And yet a living wage for someone with children in Nashville, Davidson County is $22.87 an hour. So a living wage is a major issue that Nashville, Davidson County is looking at, along with investments in education, workforce opportunities, services that need to be available that are not as available as they might be because we just don't have the funding to do some of the things that would be amazing. So having said that, we have Renee Pratt, who is the Executive Director of Metro Social Services, and she has been with the department since, I'm almost hate to say this, since 1992. So she has been down some rough roads, I have no doubt. Once she became the Director of Metro Social Services, in 2009, she instituted something called the Metro Social Services 2020 Community Needs Evaluation Report. That's what she's going to share with us today, along with a couple of people whose feet were basically on the ground as this thing was put together. These are Ms. Barr and Mr. Harper.
That will be Mr. Abdegani Barre.
I got that one wrong, didn't I? Okay.
and Dr. Garrett Harper. And thank you so much, Ms. Kenner. If you'd allow us to share the screen, we can get the presentation up and we'll start.
That would be absolutely wonderful. One last thing I want to say. Renee Pratt, I've had a lot of fun with her. She is a wonderful person who has spent her entire life here in Nashville. And so she is a product of the world that she's working in, and she knows it very, very well. Thanks, Renee. Go.
Well, thank you. I'm going to go ahead and start. And if you share the screen, we'll get the slides up and begin. Thank you so much, Ms. Kenner. I do feel like we have a kinship now after this week of trying to get on and get this presentation started, but we truly appreciate this opportunity and this invitation to present to you today. Before we talk more about the community needs evaluation, I'd just like to share with you some of the things we do here at Social Services. We really have a rich history that dates back to the late 1800s. We were the very first child welfare agency of the city of Nashville. So we were known as the very first orphanage of Nashville, Tennessee. We are also governed by the Metro Charter to provide services to all of Davidson County who might require social services needs. So we cover the whole entire county. So today we provide an array of services from indigent burial, where people have not allowed to leave means for a proper funeral, to our conservatorship program that we do conservatorships and assessments for Judge Kennedy's court here in the city to make sure people are being taken care of and served properly. And we also provide an array of family assistance services, from providing assistance of case management to some short-term and emergency needs now that we're facing based on what we're living in right now. We also provide a cold weather shelter for the homeless every year. And I don't know if you all know that or not, but we also have COVID shelters that we're providing for the homeless here in the city. And we've administered those shelters for the last 18 months, and we continue to do that today. Over the last few years, we made a paradigm shift defining what economic and social well-being means to social services by responding to crisis situations that address the more immediate needs, focusing on the well-being of our customers and more so our community. So today we're going to present to you our 2020 needs evaluation, and we're focusing more on our economic and our social well-being of the city and the constituents that live here in the city. This year's report documents the major events of 2020, during which occurred not merely the start of a new decade, a decennial census and an election, but also a devastating tornado and a very serious pandemic. So today we bring to you research about these issues and the concerns you have. And I was glad to hear that you highlighted the census information, because we use quite a bit of census data in our report as well. So with that, I'm going to turn it over to Dr. Garrett Harper, who will present this information to you today. Unfortunately, Mr. Barre and I have another engagement that won't allow us to probably stay to the end of the event, but Dr. Garrett will be able to answer any questions you may have relevant to the report as well. So if you'd share your screen, we'll start the report. Thank you so much.
Is everyone seeing the slides, the opening slide there? Committee needs evaluation.
Yes.
Good, I see the thumbs up, very good, thank you. Well, thank you very much for the opportunity to share with you some of the material which we've developed for the State of Wellbeing 2020. It has been known for the past 12 years as the Community Needs Evaluation, but it certainly does capture that fullness of the social and economic well-being of the residents of Davidson County. We issued this during the course of this year, of course, always waiting for the census data, as Ms. Pratt mentioned, that comes in over the duration of the year following. So just a little bit of an introduction. Certainly as residents and leaders in Nashville, everyone's very familiar with the changes and the challenges which the past year have brought to us. Mayor Cooper, in an introductory letter to this year's edition of the Community Needs Evaluation, highlighted and reminded us of the challenges that this year has brought, 2020 and into 2021. The pandemic, a life-changing, once in a lifetime event, which has brought the many serious human and economic tolls to our city. And then accompanying that, we've experienced as a city tornado, flooding, and many other really unusual and extreme situations. But we also recognize, as anyone as a longtime resident leader in Nashville, that there's resilience that is part of the makeup of this city as well. Before the pandemic, Nashville's poverty rate was falling, albeit modestly in the most recent year, 2019, just prior to these events. Inequality was modestly declining over the course of the decade. And between 2013 and 2018, median incomes had risen by 23%. And with the job growth, the types of changes that occurred in the economy, we did experience some of our lowest unemployment rates in 2019 in the history of the city, and also very high levels of growth in the labor force and employment. However, 2019 and then 2020 were very unusual years, to say the least. The slide that's currently appearing shows the unemployment levels in Davidson County across the span of 2020 by month. So we began the year with just about 10,000 persons unemployed and in the 2.7% range, historically very, very low. That spiked then with the lockdown, the onset of the pandemic in April, rising to historically high levels of nearly 16% and over 60,000 persons unemployed. That moderated across the course of the year into the 4 to the 5% range. Of course, that disguises a bit of what also was occurring, recognizing that perhaps women working from home, others chose to leave the workforce and were not counted as unemployed because they're not active in the labor force at this period. So we think that in actuality, the number of persons unemployed, if stated as the number of persons who wish to be working or wish to be returning to work full-time, and be participants in the labor force, that number might be a bit higher than what is suggested out of the official statistics for this. But certainly it was a roller coaster of dimensions there of unemployment throughout just a series of 12 months. A return to normal, that's a phrase that we use very, very often in our society after experiencing the past year and a half. A return to normal, though, as Ms. Kenner, you've already suggested to us that we find some very unusual conditions that we would be returning to. That from the 2019 data, 38,000, nearly 39,000 persons working full-time and earning under $12 an hour. That compared to the US average for poverty, ours was higher for 7 of the 9 years of the past decade. Comparing ourselves with some of those peer cities and metro areas, which we'll see in just a moment, Nashville has not fared very well in comparison with regard to poverty rates, where ours were higher than many of those that we typically look to compare ourselves with. Tennessee is a state with the 5th lowest life expectancy among all 50 US states, and more than 1 in 10 Nashville residents lacking health insurance. This is a comparison then of some of those cities that we would think of as top of mind that resemble Nashville in some important ways. Davidson County, of course, is the center of the Nashville metro area. So this list of counties refers to the central county in some of those familiar comparison metro regions. So Franklin, the central county for Columbus, Ohio, Fulton County for Atlanta, Georgia, Hillsborough for Tampa, Florida, Jefferson County for Louisville, Mecklenburg for Charlotte, and Travis County for Austin, Texas. So the color coding of that shows that red being the high levels of this and green the lower levels. Davidson County clearly here has had the higher levels of poverty across the span of the 20-teens. We only saw some moderating there in the most recent year, 2019, but still at a very comparable level with several of those others. And then the US poverty rate is shown in the darker green at the bottom. So for 7 of those 9 years, Davidson County's poverty rate was higher than that of the United States as a whole. Several maps here that will show some of the key features which we feature in the community needs evaluation. Poverty rates are shown here in Davidson County in the map. Those are census tracts. There are over 100 census tracts in Davidson County. Some patterns begin to emerge pretty clearly in that, in the interior of the city, almost an arc there from some of the major thoroughfares that we would see leading to the northeast out of Nashville and to the southeast out of Nashville. The bullet points there remind us that 1 in 10 Nashville seniors, persons age 65 and over, experience poverty. 1 in 5, about 20% of children in Davidson County experience poverty. As you see there in the map, those range from census tracts with poverty rate that is negligible from nearly zero, according to the federal thresholds for poverty, to as high as 72%. So we have a number of census tracts where more than half of the residents in a census tract, typically making up somewhere around 4,000 to 6,000 persons living in a census tract, more than half of those in each of those living in poverty throughout the year. Food insecurity. One of the dimensions which is a key characteristic of those who experience poverty is difficulty in acquiring the food and nutrition needs that are part of an individual and household requirement. Here from the national organization Feeding America, we have from the most recent year, and this was for the year 2020, 12.4% of the Davidson County population as a whole experienced food insecurity, an inability to meet the food needs of their households. For children, that level was even higher at 14.4% for the past year. We can imagine from much of the reporting that has gone on nationally and locally that there have been even increased challenges throughout the year and into the current year, recognizing that food insecurity remains very widespread throughout our community. The map shows, according to census tracts, households that are receiving SNAP benefits, federal assistance that is means tested for those households to receive financial assistance to procure the necessities of food for their households. Once again, there's a real correspondence between those areas in the interior of the city. We see a real clustering effect of that. We also see areas on the periphery where there's not that, in this case, percentage of households that are recipients of this, for very, very low numbers, from zero, none of the households, to only 5%. However, the red again shows that over half of the households in some of those census tracts are recipients of SNAP benefits, which would be a close correspondence with necessity for the food requirements of those households. Education. One of the really stark reminders to us is that wherever we find ourselves as a community relative to poverty, we can expect to see improvements over time, only as good as what the future holds out of the resident population of the city. So preparing the workforce for the next 10 to 20 years is a critical advantage for us to ensuring that poverty rates diminish as one of those key aspects of poverty. When we think about the cycle of poverty, education, housing, health, all of those are key components. Certainly education is a key part of that dividend. Here, data show that for the most recent year, only 1 in 5 students in Metro Public Schools is ready to graduate with a regular high school diploma and to meet the success milestones that would increase their probability for success going on to college, post-secondary education. And those are measured by getting an 18 or higher on the ACT, by scores on the ASVAB test for those that are applying to enter the military, or for those that may have taken college courses while they were still in high school. So only about 20% of the high schoolers in Metro Public Schools are fully prepared to be successful in their post-secondary education. The map shows by census tract those adults, persons 25 and over, with less than a high school completion. Here there is also some of that clustering effect we see in the interior, as well as some outlying census tracts that are highlighted in red, that adults in those census tracts as high as 20, 30, or even 40% of those adults lacking a high school diploma. So some really significant and stark challenges that are confronting us as a community that are portrayed in this slide and in this data. Reliance on outside sources for workforce has become prevalent in relationship to the existing labor force of Davidson County, that mismatch between the labor force demands and the labor force opportunities that the resident population present. The next slide here illustrates housing, really a front and center topic, certainly for our community as well in recent years, with regard to the challenges that face households, individuals, and families in meeting their housing needs. Here are the bullet points that are highlighted, tell us that 19.5, about 1 in 5 homeowners in Davidson County spends 30% or more of their annual income on housing. This typically is defined as being housing challenged, housing cost challenged or burdened if a household has to spend more than a third of its income on its housing costs. That figure is even more stark for renters, where nearly half of all renter households in Davidson County spend more than a third of their annual incomes on housing. In the year 2019, which now is a year and a half past us, the average cost for Nashville monthly shelter was approaching $1,200 and rising. Recent news reporting continues to show that Nashville ranks among some of the highest metro areas and cities in the country for rises in cost of housing, for home prices, as well as for rental housing. The blue bullet point in the center, that ×5, the average house price in Nashville is 5.6 times the annual median household income. So a significant challenge that households face. The map that's shown here is portrayed a little differently. It is for the census tracts, but it's not for individuals. It is for households, and it's for the number of households. And that's important for a couple of reasons. It does show us some patterns there, the red being the number of households, a larger number of households in a tract that are experiencing housing cost burden. This is portraying households with an income under $50,000 a year that also are spending a third of that income or more for their housing cost. And you'll see here that these are the number of households. So while there may be some census tracts that have a high percentage, there may not be many households in that tract that are earning below 50,000. This map is showing the actual number of households in each tract earning below $50,000 a year and paying more than a third of their earnings and income. So even in some of our suburban areas where the population may be a bit more affluent, there still are large numbers of households earning below $50,000 a year and paying a third of their income for housing costs. And we can see that really displayed across the county in many, many different areas where that has become a phenomenon that we're paying close attention to. Trends and patterns across time, this thought of returning to the new normal when historic patterns have been prevalent for a very long time that are a part of that fabric of poverty that unfortunately so much of our community experiences. African-American population unemployment rates are consistently double that of the white population in Davidson County. And we know from this and other analysis that we've conducted that the lower unemployment rates prior to 2020, even though they were historically low, often misrepresented the true quality of jobs, where low paying jobs may have been a part of that employment base, but as we saw in the earlier slide, really not providing a wage that was sufficient to support household and family needs. The inability in Nashville, as well as in other parts of the country, of the African-American households to grow wealth, the home ownership levels being lower, the savings, the investment, the intergenerational transfers of wealth simply are starkly different across racial lines. Education disparities continue as widespread historically and into the current period. Incarceration levels are higher. A lot of reporting in recent years from our publications and from others that reveal that we have, in fact, a zip code area 37208 near to the interior of the city that has the highest level of incarceration and post-incarceration of any zip code in the nation. As we have heard reporting on that, it occurs to us then how many zip codes are there? And there are 41,000 zip codes in the United States, and a zip code in Nashville has the highest of 41,000 zip codes for incarceration and post-incarcerated individuals. Housing inequities between African American and white population are common. Health disparities facing the different racial groups in Nashville are very stark and prominent. And then as we've noted here, and as Ms. Kenner suggested, over 41,000 Nashville adults lack a high school diploma, remaining a significant component of our workforce dynamic as we attempt to meet those challenges of new job creation, but ensuring that there is an adequate fit between preparation of individuals and the types of jobs that are being created. National and local policies, both the history and the contemporary setting of this. Historically, we've experienced segregated neighborhoods. The redlining that was part of federal and local policy well into the 20th century leaves enduring impacts on the ground in terms of settlement patterns, housing patterns, segregated schools that were a large and long part of Nashville's education history, continue to have enduring impacts in the adult population and in the delivery of education into the present. Segregated employment opportunities, those differences in earnings, the differences in occupational and industry patterns for employment between African American and white and other racial groups in Nashville are very prominent. Data display those clearly. Contemporary patterns continue that are a real outgrowth of those historic and enduring phenomena that Nashville has experienced. The segregated neighborhoods, schools, and employment opportunities then in important and unfortunate ways convert into difficulties, if not impossibility, of developing viable public transportation systems to serve the needs of Nashville, resulting in displacement of residents and neighborhoods. The gentrification that occurs today in some ways are important outgrowths of segregation in decades prior, where there are differentials in home values between neighborhoods and the opportunities and necessity and otherwise sometimes the opportunism that takes advantage of neighborhoods once segregated and converts those into gentrified and displacing neighborhoods. Mismatches between labor market needs and between jobs, a particular outgrowth of the segregation of education that has prevailed for a very long period historically in Nashville. Demographic trends at the societal level broadly and in Nashville in particular will continue to be a part of our ability to make change rapid and transformational in these topics. The share of US population that are earners and non-earners is shown on the left here, that only a little more than half of the population in the United States are earners, but that raising the question then of what non-earners are comprised of, which are shown on the graph on the right, that certainly children, those under 18 are not earners yet. The elderly, 24%, nearly a quarter of the US population, but increasing as a share of the total US population, meaning that we will have what is referred to as the dependency ratio enlarging in the years ahead. The working age population of the US becoming a smaller share, while that represented by children and those 65 and over becomes a larger share, the non-earner share of the US. Certainly persons with disabilities are employed at lower levels, both for reasons that may be obvious, but also for reasons that are ones challenging to our society to ensure that the disabled do have opportunities. Students, an explanation for why non-earners are becoming more prevalent in our society is that individuals are choosing, rightly so, to continue on with their education to higher levels to meet workforce needs of the future. Caregivers associated with different types of need in the population are here 8% of the total non-earners in the country. The unemployed actually through 2019, a rather small share of non-earners. When we were at historically low levels of unemployment in 2019, we recognized that the economy was performing at a strong level. Persons were not in the non-earner category because they chose not to work, but because they comprise these other categories that are shown here, and then other non-elderly retired individuals making up another portion of that group. Together then, thinking about the different ways that this affects, impacts, continues to be a part of the dynamic of Nashville, how to ensure that there is well-being that is experienced widely and transformationally and across groups, across race, across class, across economic groups within our community, ensuring that economic growth can benefit all residents, and here we see that even underlined, all residents and the important institutions in the lives of the population of Nashville. The vulnerability, the pandemic, which is the once in a lifetime experience that we all have been a part of in the past year, it exposed many of those vulnerabilities that were historically present in Nashville, the vulnerability of large numbers of people and workers in our leading industries, thinking about those as automotive production, as historically and still a legacy industry of printing and publishing, of tourism, of the music industry, of the growing technology industry here, and how the pandemic really changed and disrupted lives and workforce of those even which were very stable households, very stable communities in our city, where a return to the new normal for some will be a return to normal of difficulty for others that may have experienced difficulty for the first time at the profound levels that have occurred in the past year. And across all of this, to define, to articulate, and identify a purpose-driven growth that benefits well-being. It's a connecting the dots, tying these things together so that strategies, direction, growth, development in the economy of the city are well matched to the well-being status. As we've continued now over 12 years to develop the community needs evaluation, it does highlight those aspects of poverty, of the shortfall that communities, individuals, and households experience, but to continue to not only provide the descriptive data that is there, but to be prescriptive, to develop strategies that will align closely with the needs that are identified in that needs analysis, and to learn from the best of what exists around the country in terms of best practice, the practices grown out of Nashville's own experience, so that well-being is the dividend that is the value by which all growth and all development is considered, both before, during, and after that occurs. Poverty in its landscape is a very complex phenomenon. Here in the slide, we see, starting at the top, work opportunities, wages that support family needs, housing issues already seen in several of the data points which we considered, transportation, ensuring that that's affordable, accessible, even in a very large community like ours. Nashville at 500 square miles and 700,000 people finds challenges in delivering the transportation needs across all of that span of place and type. The health dimensions of our community, that unless the person, the individual, has access to work, access to transportation needs, health, being healthy. Next, being educated properly as a fit between the work, the labor force availability that's being developed in the community. Family structure, changes in household composition. About a third of the households in Davidson County are headed by single female. We also know that single female headed households with children can expect poverty rates at about 50%. The likelihood of being in poverty for a single female with children, that household is likely to experience a 1 in 2 chance of living in poverty. Social networks, ways that individuals find opportunities not only through family and friends, but through those in an extended social network. Those not in their immediate and frequent social networks will be occasions for learning about job and employment opportunities, education opportunities, and others in the city. Histories of racism, of investment and disinvestment in communities, as mentioned, with redlining and other historic practices that led to segregated communities. Trauma and disaster, without saying the past year and those profound effects that has brought to Nashville, and the lack of resources in communities, and as mentioned, with investments in our communities in new and different ways based on data such as these. Data do indicate that there is a chronic and persistent poverty rate in Davidson County. We saw earlier in the slide that even in the past decade of significant economic growth and change in our city, that we have had poverty rates that were higher than those of the US, higher than those of cities that we refer to as our peers. These lead us to conclude, out of the 12 years of the research in these publications, which we've issued and shared with the community, there are important and powerful structural factors, and those such as the changing dynamic of population regarding the age composition, the aging of our population. And as seniors become a larger share of the population, we have a change in the dependency ratio, that the working age population becomes smaller relative to those other parts of our population. These suggest to us that structurally poverty is becoming more complex, becoming more costly, and certainly ways that are more enduring based on all of those factors. Ways that we can continue to think about this out of strategy direction going forward, traditional thinking, which may be very linear, into systems thinking that refers to the complexities which are suggested in that prior slide. That poverty is multifaceted. It's experienced by each individual, each neighborhood, each household separately and individually, developed and grown out of the historic past and the current realities, and how to respond to those in a systems way for a complex system to think about that in complex responses that would help to transform the whole. Addressing poverty and well-being requires unified effort. Everything about a household life, everything in that cycle of poverty connects to all of those others, whether it's health, education, transportation, work opportunity, or the other macro challenges that have been a part of our society, such as disinvestment and racial distinctions with regard to policy implementation. Aligning these approaches can help to build meaningful opportunity. This will require, and it also will deeply involve, innovation and a commitment to sustain and to real changes. Recognizing across all of this that everyone pays the price of poverty, everyone pays the price of the working poor and the challenges that our society, federal on down to the local level, does to help to make up for those differences, those shortfalls that households experience. So we all pay the price, directly, indirectly, for those that do experience inadequate social and economic well-being, those disparities which we've highlighted in the data and in the perspective that's shared along with the data points that are a part of the presentation. Understanding poverty, understanding it fully and understanding it in its complexity. The lack of understanding of poverty in its complexity simply hinders action. Trying to address transportation needs, education needs, health and housing needs, apart from the consideration of each and every one of those, makes each of those individual efforts not fully successful. Doing these in concert with one another. The totality of poverty, in fact, is comprised of these many different features, which are part of the data which we're sharing here today. A lack of continuity can also hinder this action, whether it's across election cycles, across decades, across generations, ensuring that we're thoughtful about the work that we do that is a part of the historic past that has brought us to this point, but also that decisions made today sometimes will only have their influences, their outcomes, their realization many years from now, such as those first graders entering our schools today that will be a part of the workforce only 12 or 15 years from now. Economic and community developments efforts not fully aligned with well-being also hinder our ability to resolve some of these enduring phenomena that are a part of the Nashville framework in terms of well-being, ensuring that recruitment of business, the development of jobs are well matched to the types of capabilities, interests, and the aspirations of the resident population and the student population of our community from K through 12 on through higher education. Local decisions have enormous influence in the change in the actions that are directed toward the well-being of Nashville's resident population. Certainly things that are decided at the federal level have important implications for Nashville and for Tennessee, but many of the decisions regarding transportation, education, housing, health, the other aspects of our lives are made at the local levels. Accepting proven results, those that are science-based, evidence-based, where there's empirical evidence that suggests to us what works best, adopting those, adapting those to the Nashville needs, rejecting those where science and empirical evidence would suggest that those decisions and those paths would be less of an advantage for us to resolve the well-being challenges which we face. We've continued over the recent months to have opportunity to share the idea of being more coherent and embracing across what well-being can be. for our community, using data as the basis, as the foundation for making decisions, and then for the decision-making leadership of the city at all levels, all institutions, to embrace that, to utilize that as a way to demonstrate the types of actions that relate to the opportunities which are presented to ourselves. Davidson County has done extremely well in the past decade. The data which we share here also shows that there are many challenges that linger as a part of that, and how to continue to do the things that Nashville has done well over a long period from the formation of metro government 60 years ago, how to continue to be innovative and ambitious and tackle the hard issues, which in some cases become even harder with the complexities that were identified here in these prior slides. So it's been a real pleasure to share this data with you. We find this a real opportunity, which we're grateful for here today, but also one which is an important facet of the work of Metro government, of Metro Social Services, to provide this as a resource and as a foundation for decision-making across our community, all of its institutions and all of its leadership. At this point, I'd like to turn it back over to Renee Pratt for comments and questions. She is here with us for some thoughts, and if there are any questions that anyone has from the group, certainly be happy to respond to those.
Yeah, there are a couple of questions up right now. And let me start by asking you from the chat room, how has the gentrification of Nashville impacted poverty in the city and in the surrounding counties? And the next question is really, to me, kind of a fascinating question. Where are displaced people going when they no longer can live here? And I don't think we're talking about, I think we're talking about an awful lot of people as we continue as a community to raise neighborhoods.
It's a great question, and it's a phenomenon, especially in the second half of the decade just past, which we've seen a great deal, which any of us in Nashville just driving around the city seems to continue at a rapid pace. It's one where it's for those of us looking at this in research, we're hungry for the data that will continue to show what answers to that fully will be, but it no doubt is creating displacements, resorting of population. It becomes in some and perhaps many cases a costly endeavor and phenomenon for us as a city in terms of creating the stability of serving the needs of poverty, whether it's longtime institutions, public, private, nonprofit that have served poverty needs of communities, in some cases for decades, but the service population, the volunteer base of those organizations may very rapidly relocate, which becomes costly and difficult to maintain the continuity of effort. The answer to the question, where are people moving to? Certainly some within Davidson County, and we would come to that conclusion based on, let's say, the stability of the poverty rate across time. So that while there are neighborhoods and communities that had high poverty that may have experienced a lot of gentrification and change, when we see the next year's data, whether that's 2016, 17, 18, or 19, we would see that poverty levels for the county as a whole remained relatively stable and high as they had been in the previous year, meaning that persons living in poverty may simply be moving to other areas, maybe combining households. There is a suggestion of that. There is some modest movement outward of populations that experience hardship, working poor households that may continue to retain their occupation in Davidson County, but choose housing that is in a suburban or even exurban county, 2 counties out, realizing that the impacts of that change on Davidson County and the entire region is great, as well as we attempt to develop viable, affordable, accessible transportation networks that in that case would become ever more difficult, challenging, and costly as people travel longer distances to get from home to work. So the short answer is we don't know as much as we would like from one year to the next, but we'll continue to see that phenomenon. Poverty population moving within Davidson County, some moving outside of Davidson County, but continuing to be a part of the economic life of Davidson County, which really has an important implication for the future of the transportation, the congestion, and resolving some of those longstanding needs of Nashville in that area.
Madeline, I know the answer to your question. Yes, it has been shared with the Metro Council, and it's been shared with a number of agencies. And I don't know what these folks are doing with the information. It's my hunch that Renee might have some feedback from people after they have seen this. I don't know. But my next question here on the board is well, this is really one that both you, Dr. Harper, and Ms. Pratt can certainly answer. What strategies can Nashville use to promote a living wage within the limitations imposed by our state legislature?
Certainly at the macro level, it's using data like this to ensure that business growth, business development, business recruitment, all of those are as closely aligned as possible with the K through 12 educational offerings, higher education, ensuring that our workforce, the realities of our workforce out of the resident population and the opportunities for training and education to meet those, ensure that there's a good fit. We've had a long history in Nashville of doing well in that. We've grown unique industries here, whether it was printing, publishing, music, automotive, healthcare, and others. As we go into a new environment that's more technologically advanced, the IT industry and others, to ensure that there is a good fit between what the resident population offers in its experiences, its training, its education, and its aspirations, and the job creation that's occurring here. So it's a bit of a macro solution to that, but it's one that doesn't alter quickly. We certainly see the creation of a lot of very good paying jobs in Nashville, ensuring that Nashville residents are as fully capable, ready, and prepared to assume those roles is a real imperative for the city to ensure that Nashville's resident population are the beneficiaries of those. I think you may be on mute, Jessica.
Thank you, Dr. Harper, very, very much. Yes, I was on mute. I think that we have learned a great deal from your presentation, and we've got 3 or 4 minutes left before we draw to a close. Other questions that anyone might have, or any final comments that the folks in your world want to share with us?
I'll turn it over to Ms. Pratt.
Thank you so much again for this opportunity. We appreciate any time we're asked to share this data, because we have a wealth of information, and I think the city really needs to be aware of, along with our city council and our legislators that make decisions for us here in our county. We also produce another document that I'd like to share with you and tell you about, Ms. Kenner, and we can get it to you when we produce this document. It's called Know Your Community. It covers the 35 council districts here in the city, and it gives information about education, employment, health, well-being, things of that nature. And we produce this document as well annually. So we plan on getting it out hopefully over the next few months, and you can find it on our website, and I'll get it to you, Ms. Kenner, as well, to share with the group.
That would be wonderful. We have 2 more questions here that I want to share with you. One of them is very pertinent to what you were kind of saying about supplying us with more information. Is there anything that you think we can do to help improve the situation as individuals and as voters?
I think just continuing this conversation. I mean, it's quite a bit of information to digest at one time, I know, but it's valuable information on how we move forward to look at how we advance people here in our community around well-being. And that's what's most important to us now. Also, on an ongoing and a regular basis, and when you opened up, I'm sorry I missed the lady's name, but she offered an opportunity to join your organization. And I think I would like that opportunity to join your organization.
We would love to have you.
and continuously provide ongoing data and research on what we're finding here for local government, the city, as also the world. So that would hopefully be an asset to us, for us to bring this information to you, and then for you all to disseminate it and getting out to your colleagues that make differences here in the city. That's what our ultimate goal is.
We have one last question here, and it's, watch, we got two now all of a sudden. Is the large hospitality industry here responsible for the many low-paying jobs?
I'm going to let Dr. Garrett answer that. We have just a bit of information on that as well.
Okay, you might want to stay, Renee, you might want to stay for a second, because my next question is, how is the county working to create and maintain affordable housing to combat gentrification? And has a severe housing cost burden been assessed for the county?
The cost burden has not, to my knowledge, been assessed for the county. I don't think, just conferring with Dr. Garrett, that it has. Also, as it relates to affordable housing, you know, there are several things in place around the Barnes Fund that assist with affordable housing out of the mayor's office. I don't know if you all are aware of that or not. And then there are also other groups that are looking at affordable housing, many groups here in the city that address this issue as well. As you all well know, people define affordable housing differently. So there's low income housing and then there's affordable housing. So we don't want to confuse the two, but again, those are two areas of need that definitely need to be addressed here in the city as we see that the need continues to grow. And it continues to grow more so around our homeless community as well. So we don't want to forget those neighbors either. So great question.
Very, very good answer too. Thank you so very much for presenting this information to us today. I certainly want to thank your compatriot, Dr. Harper, for all of the information that he shared from the study that you folks have done. And we'll be interested in knowing other things that are happening in Nashville. And if you join our group, you can let us know those things on a pretty regular basis. So
I look forward to the opportunity.
This is great. Thank you so much, Renee. Thank you, all of the folks in your shop, so to speak, who work together to make this a presentation for us. And I have to say, it has, on any level that you want to come up with, been an eye-opener. So
Great.
many, many thanks.
Well, great. Well, thank you, Ms. Kenner. It's great meeting you and working with you and your organization. And again, hopefully you send me the information about joining. I look forward to this opportunity and to continue to share our data and our wealth of information with you and this organization. So thank you for this opportunity.
Absolutely. Thank you so much. Bye-bye.
Bye-bye. Thank you.
I think the meeting, Madeline, anything else that needs to be said?
No, Carol, I think you did a great job, and thank you, Renee, and your group that presented this information. And we'll send everybody a ask, you know, for membership in her group.
Thank you so much.
Thank you. You all have a great holiday weekend and stay safe. Thank you.
You too. Bye-bye.
Bye-bye.
Well, I was hoping